Hi and welcome. I'm trying to learn medicine. Today, Pernicious Anaemia, and after we've done that, we're going to do leg injury prevention training. And if you participate in the leg injury prevention training, then it's better the almost. And we did this already. We had in the previous part iron deficiency anemia. Now, and there was something to it. Since we did that part, in the last part, I heard someone talking about that, and I'm taking it again of salt. I have no reason to suspect that something is wrong, overall, but I'm not really convinced. Now, the thing was that it was said in this video that in the United Kingdom, the guidelines were that people should take once a day a tablet if they have prescribed to take iron deficiency, whatever tablets. And in the United States, that the people are told to take them 3 times a day. And that it was changed in the United Kingdom down from 3 to 1. And as a reason was when explained that the human body releases, after having gotten doses of iron, some stuff, some hormone of which sounds like something like heptas or whatever. And the human body releases it, and that then furthermore absorption of iron is because of that hormone was released, because just a dose of iron was received. So iron is then for some time not receivable after iron was taken. So iron is taken, this hormone is released from the human body, and further iron is not absorbed by the human body for, was said precisely 24 hours. I think it's oddly specific, maybe also around it's like 6 or 28 or whatever, around a day. And that is the reason went out in this video that people in the United Kingdom are advised to take a tablet once a day, because it doesn't bring anything to take a signal further. Now, I'm taking it all, I didn't say that at the beginning, we're talking about internal anatomy, blood, and this is not medical advice in any form. Now, and the idea here was written by iron deficiency anemia, that people, something said for 6 months. Outlook, excellent, the condition should be cured within 6 months of treatment. Now, this book is from the 80s, that sounded recently. If something like that was found out, that now 1 tablet per day is sufficient, but it could change something with 6 months. Maybe it doesn't change anything because it's still the same. Still 6 months. But I think that is very interesting, and I also want to know. Okay, I have a lot of questions to it. And I don't know if it is true, and I don't know, maybe we can look at guidelines. That would be something which someone could look up. What the guidelines are for iron tablets in the United Kingdom and the United States. I don't know, and this is not medical advice. I wanted to say a few things more to that, but I don't remember right now. Yes, we were thinking about a part of this iron deficiency. How much stores has the human body of iron? And it is interesting. If it is even true, that there's basically a stoppage, a block, an obstacle in the way, something released which stops to get more iron in a short period of time. I think that is something interesting. And I want to know way more. This is not really part of medicine, but I want to know way more about how it works with iron. If it's actually, but after people have gotten air dose, now what is the dose? Does it have to be that high? That high? What if you waste basically your dose? Imagine you take just one dose, one little form of iron. Is it then released? And that dose is supposed to. Imagine that is because of people. This is also speculating. This is not medical advice. Imagine people taking a low doses of iron, and when that hormone is released, I don't even know if that hormone exists, and that is why we have an iron deficiency, because the first doses was too low. So how high has to be the doses to effectively release the hormones if it even exists? And why is it released? Can the human body get too fast iron? Could it be when something we made out of stopping that hormone to be released? So basically I just wanted to give you a little, what is it called, a little catch-up, or what is it called? But I heard something new to the thing, since we had the first part of iron deficiency. Now, pernicious anemia. A form of anemia which develops when the bone marrow lacks vitamin B12 or other substances needed for the proper formation of blood. So anemia is the too little amount of the hemoglobin in the blood. And by iron deficiency, it was too little iron there, so that the production could not be done of hemoglobin. Now we're having that vitamin 12 is missing, or other substances to form it. Yes, because this is about anemia. Anemia is too little hemoglobin. It can be caused in most common times out of iron deficiency, but also something else like vitamin B12 can be missing to make the hemoglobin. This is not about iron deficiency, but this is about anemia, so missing of hemoglobin. And again, this is not medical advice. The condition is common in people with blood group A than in those with blood group, I think it's 0. People have different blood groups, and it's more common in people who have A than in people who have 0. Symptoms. The tongue is sore, smooth and inflamed in places. I'm talking about no medical things. So, medical symptoms. People have persistent diarrhea and tingling in the fingers and toes. In severe cases, the facial skin may assume a lemon yellow tint. Duration. The condition persists until treated. Let's go to what the symptoms again. So the symptoms are to having a sore, smooth and inflamed tongue at some places. How does it? What is it from combination? So smooth and inflamed. People have persistent diarrhea, so they have problems. And it's tingling in the fingers and toes also, and also a lemon yellow coloring of the face maybe. Duration, persistence until treated. Causes. Failure of the stomach to produce an enzyme, the intrinsic factor, I don't know what intrinsic means, intrinsic factor, which is needed for the absorption of vitamin B12. Oh, that is interesting. So here's the problem, not that vitamin B12 is not there, the problem is that now the stomach cannot get the vitamin B12 out of the food, so that whoever is doing the blood cells cannot do the blood cells. So the problem is not even that the vitamin B12 is not eaten, the problem is that it's not absorbed. This failure results from autoimmunity, certain drugs, or follows removal of the stomach. And that has been called gastrectomy. People can have a stomach flu. This failure results from autoimmunity. I don't know what that means. Certain drugs and also a removal of the stomach. Complications. With early treatment, these are few. They may include heart failure, degeneration of the spinal cord, and cancer of the stomach. Okay, so complications of having Pernicious anemia. And that is that the human body cannot get the vitamin B12 out of the food, so it cannot produce the hemoglobin, the oxygen-carrying blood cells. And that can then cause, and I don't understand why, in heart failure, degeneration of the spinal cord, and cancer of the stomach. But the symptoms are tongue is sore, smooth and inflamed, persistent diarrhea, tingling in fingers and toes, and lemon yellow. Why is it completely different symptoms when having a symptoms of iron deficiency anemia, sore tongue and inflammation, dry, brittle nails? It's both anemia. Why is it so different? Okay, the complications can be the failure of the heart and also degeneration of the spinal cord, so of nerves basically inside of the spine, and cancer of the stomach. Treatment in the home, none all the time. When to consult the doctor? Immediately the symptoms described develop. So if people have a sore, smooth and inflamed tongue, persistent diarrhea, tingling in fingers and toes, and in severe cases, the facial skin may assume a lemon yellow tint. This is no medical advice. And then also, what the doctor may do? Take a blood sample for testing. By taking blood and testing it, refer the patient to hospital for further examination, by examining even more, and which may include testing the stomach or a sample of bone marrow. How does it look to take a test of bone marrow? If the diagnosis is confirmed, prescribe a course of vitamin B12 injections. So injections don't work. It is the stomach who can't absorb it, but the human body still needs it. And the human body also can use it. It just cannot absorb it. And how does that problem happen? Why can it be that the stomach can do everything full fine, and just this one particular thing, B12, can it not? Or is it that there are also then other things? It would be interesting if people have vitamin B12 from an absorption problem, if they also have problems to absorb other things. And if not, it would be even more strange, as if they could also not take other things. Why could it happen that the stomach cannot absorb the vitamin B12? but the human body needs it and can use it. If I get it through injections, it all works. So the people can get vitamin B12 injections. Prevention. The only types of pernicious anemia which can be prevented are those which have an underlying cause, such as gastrectomy or prolonged treatment with an anti-epileptic drug. Okay, people have for some reason the necessity to take an anti-epileptic drug, or people have also something called gastrectomy. And if that is cured, then it could be cured like that. If not, then there has to be the vitamin B12 injections. And again, with no medical advice, and this book is from the 80s. Outlook, good. After the initial course of treatment, injections must be given indefinitely to stop recurrence. Okay, as long as treated, that looks good. Do basic. No, that was a medicine part. If you will give medicine, you can go directly to the next part of medicine. And we will do now the leg injury prevention training. If you stay and participate in the leg injury prevention training, that is that you always go to a stable standing stance and just bring your leg in front to the side. And the other leg swing to the side. It would be good to know what the word Pernicious means. I heard it a couple of times already. And the other leg in front and back. Other leg in front and back. And now lift the leg up, breathe in, pine pill crow, and breathe out the leg to the side. Again in, and to the middle, and down. Other leg up, out, again in, out in the middle, and down. And leg up, breathe in. No, we're not doing that another time. Leg up, hands out, and go over to the side of the hands, and down to the lower. Go over to the side of the hands, and to the other side of the hands. To the middle. And now legs over to one side and hands over to one side. And change. Then a little bit down. Other leg up. Hands over to one side. Over to the other side. And now one leg up and press with the knee up to the side. Up to the side. Other leg up, press with the knee up to the side. And next exercise. It's the bycutter, not the proceptor. We're standing good on one leg. This exercise can go onto the knee. Turn over to the knee. Go down. Over to the other side. And up. And again. Stand good. Turn over. Go down. Over. And up. And other leg. Stand good. Turn over. Go down. To the other side. And up. And again. Stand good. Turn over. Down, over, and up. And now a clock. This exercise can go again on the stand good. And I'll go always in 90-minute intervals to the sides of the leg. And go always with the knee a bit down. And now the same thing with the other leg. Start front, the other side. It's 9 o'clock and 7:30 and 6 and 4:30 and 3. And now the pipette. Don't do this exercise if you're pregnant. Stand good with the leg upper heel onto the ground, lift the heel off the ground and place it again on the ground. Upper heel onto the ground and lift the heel off the ground and place it again on the ground. And we stand. Leg in and down. In and down. Other leg and down. Now a horse. Another leg in. And with the other leg in and out. And you can do now the horse again, or you do the camel, where the whole body goes down. And the other leg in and back. And we're ending legs wide apart, breathing out on. And breathing out. Again. Out. Again, in close the legs. And breathe again out. That was the leg injury prevention training. I thank you very much, and at the next time.